Hello everyone, my name is Nizar Khayat. I'm one of the new residents and will be hosting this diabetes support group presentations for the next couple presentations moving forward. We're excited to be here. I'll introduce the rest of the co-residents in a little bit. But we just kind of wanted to say thank you guys for joining us, and hope you guys are all doing well during these COVID times. So moving to the first slide, I just wanted to give you guys an overview as to what we kind of expect throughout these presentations. So what we would like to do is the first thing we will do during these PowerPoint presentations is we will review last week's takeaways and discuss any questions we received. We will then discuss the topic for today. After that, we will summarize the topic, and then we will have a closing regard / end activity based on the topic for today. So for today, what we wanted to do is kind of introduce ourselves and discuss vaccinations. And so I'll start off with myself. My name is Nizar Khayat. I attended pharmacy school at the University of Nebraska Medical Center. A little bit of fun facts about me. I was born in Haifa, Israel, and I have pictures up here to show you guys. My hometown is in Nebraska, Kearney, Nebraska. We're known for the sandhill cranes, so there's some pictures there, as well as our arch. And these are my family members. I have 2 sisters and 1 brother, and then another brother, and that's our dog, as you can see in that picture. My interests include music, food, and outdoors, and this artist group is Mumford & Sons. Hopefully you guys know who they are. They're a good group of musicians, and so that's a little bit about me. I will let Mallory take over next.
Hi everyone, my name is Mallory Clay. I went to school at the University of Kansas. I'm originally from Texas. I was born in Stephenville and I grew up in Aledo. It's outside of Fort Worth. My family is my boyfriend and I, Freddie, and our 3 cats. We have Cupcake, Bombay, and Tobacco. And some of my interests include embroidery, crochet, reading, and cats.
Speaking of cats, my name is Kat, short for Catherine, last name Oyoa. It's a tough one to say, so you can practice if you want. I went to school at Creighton University, School of Pharmacy and Health Professions up in Omaha, go Jays. I was born in Hoxie, Kansas, which is in the very northwest corner up by Nebraska and Colorado, and spent most of my life in western Kansas. But I claim Wichita as my hometown. I lived there and I raised my daughter there. I put up a throwback photo of my family growing up. I'm the little one on the far side in the yellow dress, just in case you can't see a resemblance. But I have 3 sisters and a brother. Oldest siblings are twins. And currently living with me here in Salina is my daughter. Her name is Kira, and we have a golden retriever, and his name is Finley. So we have a lot of fun together. I really love traveling. This picture is from when I went to Puerto Vallarta, Mexico, just after graduation. I love tacos. Doesn't matter what kind or how many, I love tacos. Also really enjoy dogs and running in my free time. So I'm going to turn it back over to Nizar, who's going to discuss vaccinations with you.
All right, so that's a little bit about us. We would love to hear a little bit about you guys, get perspective from our audience. And so if you guys can send us a little bit about you guys to our email that I will share with you guys at the end of this presentation, that would be appreciated. We love to hear who we're speaking to. gain some perspective on that. So moving forward to the topic for today, we wanted to speak about vaccinations and the importance of getting vaccinations. So I just wanted to give a very broad topic discussion about vaccinations. And so the first thing I wanted to discuss with you guys is what is a vaccine and how does it work? So starting off, vaccines prevent diseases that can be dangerous or even deadly. They work with your body's natural defenses to safely develop protection from a disease. A vaccine helps your immune system to produce antibodies, just like it would if you were exposed to the disease itself. After getting vaccinated, you have protection from that disease without having to get the disease first. And so that's a little bit about what the vaccinations are. And that's why they are so powerful. Unlike most medicines, which treat or cure a disease, vaccinations prevent them. All right, so what COVID vaccines are available? So there are 3 vaccines that have received emergency use authorization from the Food and Drug Administrations, and those include companies like Pfizer, Moderna, and Johnson & Johnson. So you might ask yourself, what is an emergency use authorization? So the FDA will issue an emergency use authorization when certain criteria are met, which include that there are no adequate approved available alternatives. And then the FDA's decision is also based on scientific evidence available showing that the product may be effective to prevent COVID-19 during the pandemic, and that the known and potential benefits of the product outweigh the risk in all cases. And so all of these criteria must be met to allow for the product to be used during the COVID-19 pandemic. And so that's why these vaccinations received emergency use authorization. And so what we can concur from this is that all 3 COVID-19 vaccinations are safe and highly effective against serious illness, hospitalization, and death. So the Pfizer and Moderna vaccines require 2 doses given at least 3 to 4 weeks apart, and people should get both doses to be fully vaccinated in order for it to be effective. The Johnson & Johnson is only a 1-dose series. Moving forward, what are the benefits of getting a COVID-19 vaccination? So COVID-19 vaccines will help keep you from getting sick and hospitalized from COVID-19. The combination of getting vaccinated and following CDC's recommendation to protect yourself and others will offer the best protection from COVID-19. The COVID-19 vaccine offers your body a head start to start developing a way to protect you from COVID-19 if you were to get it. Now we understand that some people may be concerned about getting vaccinated, and while more COVID-19 vaccines are being developed as quickly as possible, routine processes and procedures remain in place to ensure that the safety of any vaccine that is authorized or approved for use is met. And so the next presentation that I wanted to present to you guys is how do we know that the vaccines are safe? So vaccines go through one of the most serious testing than any other pharmaceutical medication. What they do first, and this is very broad, is that they will take a small group of patients and they will give them a trial dose of the vaccine. If it passes through those small group of patients, then it'll go to a more specific group of patients and a bigger population of patients. After that is approved and it is studied, a phase 3 trial will be done, and the vaccine will be given to tens of thousands of people and then tested for efficacy and safety. The big thing is that we understand the importance of being open and honest about the safety and development of the vaccines, especially for communities who have suffered consequences of medical mistreatment. So it's important to know that vaccines go through more testing than any other pharmaceuticals. Before any vaccine is made available, it must go through rigorous development and testing. Manufacturing is critical. Every dose must constantly be highly efficacious and tested for quality. Additionally, there is extensive testing in clinical trials to prove safety, and that is straight from the CDC website. So after these phase 3 trials are done where they went through increasing number of patients, what the CD does is it has an advisory committee, and they'll look at the data to see if the vaccine is safe and if it works. And then they give advice to the U.S. Food and Drug Administration. So the CDC gives them authorization to the FDA, and then the FDA looks at the data and from the advisory committee and decides whether to approve the vaccine. And the vaccine is only approved after all of these steps are done and various teams of reviewers are sure that it works and it's safe. Again, safety is a top priority, and safety monitoring for the COVID vaccines have been the most intense and comprehensive in the history of the United States. So again, how is it safe if it was made so fast? So the timeline was sped up, but never cut any corners on safety. Here's how. As we can see here, we already had helpful information about coronaviruses. They have been studied for a long time. So we weren't starting from scratch. A lot of people participated in clinical trials and they volunteered, so we didn't have to spend a lot of time finding volunteers. The US and other governments invested a lot of money to support vaccine companies with their work, so that was never an issue. Manufacturing happened at the same time as safety studies, so vaccines were ready to be distributed once they were approved. And what I show here in this slide is on the bottom, we can see here that traditional timeline of vaccinations is right there. And then in the COVID-19 vaccine up here timeline, there was no misstep. The only difference is during the testing, they were also manufacturing and developing the vaccines so that when they did get approved, and if they did get approved, we could mass send these vaccines to everyone so that we can get as many people vaccinated as possible. So next question that we've had a lot, can I get the COVID-19 from the COVID-19 vaccines? And the answer is no. For you to get COVID-19, there has to be an active and live virus. And with the COVID-19 vaccine, the vaccine does not contain any live virus that causes COVID-19. So this means that you can't catch it from COVID-19. You can't catch COVID-19 from the vaccine itself. Next question that we had is, do the COVID-19 vaccines have any side effects? And what we have here is serious side effects and what we've seen is serious side effects from the vaccine, from any vaccine, including the COVID-19 vaccine, are rare. It is possible that some people may have side effects, which is a normal sign that your body is building protection, as we talked about earlier. These side effects may affect your ability to do daily activities, but they should go away in a few days. The most common side effects that we are seeing are minor, and they include tiredness, headache, pain at the injection site, muscle or joint pain, chills, nausea and vomiting, and fever. The next question we have here is, should someone with allergies get the COVID-19 vaccine? And so what we know is that you should not get the COVID-19 vaccine if you have a history of severe allergic reactions, such as anaphylaxis, to any ingredients to the vaccine. The vaccine do not contain eggs, gelatin, preservatives, or latex. The ingredients listed can be found in these websites here based on what vaccine you got. And what we recommend is that if you have a history of severe allergy to something else that's not in the vaccine, let's say peanut butter, we recommend that you discuss it with the healthcare provider before receiving the vaccine. A lot of people are concerned about pregnancy during the COVID-19 vaccine and if they should get it there. So one question that I have received before is, I would like to have a baby one day. Is it safe for me to get a COVID-19 vaccine? And the answer is yes. People who are trying to become pregnant now or who plan to try to in the future may receive the COVID-19 vaccine when it becomes available to them. And based on what we know right now, experts believe that the COVID-19 vaccine is safe for someone who is trying to become pregnant in the short or long term. There has been no evidence that fertility problems are a side effect of any of the vaccines. Next question is, can someone who is pregnant currently or breastfeeding get a COVID-19 vaccine? And the answer is yes. In fact, the American College of Obstetrics and Gynecology, these are the people that build guidelines for how we treat patients who are pregnant or breastfeeding. They recommend that the COVID-19 vaccine be offered to pregnant and breastfeeding individuals. Right now, we don't have much data about whether the COVID-19 vaccines are safe in people who are pregnant or breastfeeding, but so far, scientists haven't found any safety concerns for pregnant people who are vaccinated or for their babies. We do know that getting sick with COVID-19 during pregnancy can increase the risk of severe illness and might increase the risk of outcomes like preterm birth. Getting vaccinated, again, is a personal choice for people who are pregnant or breastfeeding. And I think that I would recommend a discussion with your healthcare provider. Might help you feel more comfortable, but you aren't required to get their approval before getting vaccinated. So just keep that in mind. A big topic currently, and when COVID vaccines first came out, is can the COVID-19 vaccine change my DNA? And the answer is no. COVID-19 vaccines do not change or interact with your DNA in any way. Vaccines teach our immune system how to fight against a specific virus. In order to do its job, the COVID-19 vaccine does not need to go inside the nucleus of the cell, which is where our DNA is kept. And so this means the vaccine never interacts with our DNA in any way and has no way to change it. So our next question that we received is, will the vaccines work against COVID-19 variants? And what we know is that it's normal for viruses to change as they spread and for new variants to appear. So that's what's happening currently. So far, studies suggest that the vaccines provide protection from the known variants, like the Delta variant that we are experiencing right now. And even when a vaccinated person gets infected with COVID-19, they are very protected against severe disease and death. I wanted to include this picture here just to show you guys what we have been seeing in the hospitals and clinics. So as you can see here, we have two patients x-ray, one that is vaccinated and one that's not vaccinated. And as you can see here, what we like to call these is a pharmacist x-ray, because we can tell as we look, and I'm sure you guys can tell as well, is the top one is a vaccinated individual. We can tell that the lung looks good and not inflamed. The white stuff is what we're concerned about with COVID. And as you can see on the bottom x-ray, it is surrounded with this white inflammation and scar tissue. And the fun fact is the top patient was a 56-year-old with asthma, which we know is a patient in a high-risk population. And the bottom patient is just a regular patient, no comorbidities, 34 years old, with a BMI of 32. And you can clearly tell the difference, and what we believe is due to the vaccine itself. So I think that is worth highlighting, and to give you perspective on real world what we're seeing with vaccinated and unvaccinated individuals. So now that we know a lot about the vaccine, the next question is, will I have to pay for the vaccine? And the answer is no. The vaccines are free for all Kansas residents and anyone in the United States. You'll never be asked for a credit card number to make an appointment, and you can get a vaccine even if you do not have insurance, a driver's license, or a social security number. So how long after the COVID-19 vaccine does it take to be effective? How long does it last, in short? And it usually takes a few weeks for the body to build immunity after vaccination. This means it's possible a person could be infected with the virus that causes COVID-19 just before or just after vaccination and still get sick. This is because the vaccine has not had enough time to provide protection. We do not know yet exactly how long the COVID-19 vaccines will provide protection, but experts continue to conduct more studies about whether the vaccine also keeps people from spreading COVID-19. do I need to keep wearing a mask if I am fully vaccinated? And the answer is only in certain situations, including areas of high population. So like public transport, healthcare facilities, schools, and other settings with vulnerable populations like congregate care. This is all based on CDC recommendations as well as the city and state that you're in specifically. What we would recommend is that you stay home and get tested if you feel sick, and isolate yourself if you test positive for COVID-19. So as we went through the vaccinations, I want to narrow it down to our population here. So what about people living with diabetes? So people with diabetes, what we know so far is that people with diabetes with COVID-19 are at a greater risk for worsening prognosis and mortality. And that's why this group is considered a high-risk population. COVID-19 vaccines have decreased the risk of severe symptoms, including hospitalization and mortality. And that is known through studies as well. So what we'd recommend is that you continue to follow CDC guidelines, and in doing so, this will decrease the risk of acquiring and spreading the virus. Again, our recommendation is hopefully through this you have more knowledge about the vaccinations and that you continue to follow CDC guidelines. So I just want to recap really quickly on the topic for today. What we learned today is that vaccines work, and they're currently playing a crucial role in the global effort to address the COVID-19 pandemic. The 3 vaccines did not bypass any part of the development process, and thus they are considered safe. I believe currently they are being in the process of getting FDA approval, which should happen within the coming weeks to months. The vaccines do show that they help protect against variants, and it is effective in helping decrease patients from severe disease, hospitalization, and death. And our last topic recap is we want you to continue to stay up to date and follow current CDC guidelines and recommendations. And this will help you protect you and your loved ones from COVID-19. So that is all I had for today. Again, this is the email that I have for you guys. If you could introduce yourself a little bit, tell us a little bit about you, and then send it to this email. We'd love to hear a little bit about you guys, and we look forward to these emails as we receive them. Thank you guys for your time. We appreciate you watching this video, and we look forward to the next topic discussion.